Nearly did the fatal mistake of forgetting to put the microphone on. Good morning, everybody. I hope you've all had a chance to get some tea, coffee and pastries to make you feel comfortable up over there. For those of you who don't know, just outside on the right-hand side is a nice cold drink, and down through onto the next floor is just where the toilets are, if should you need them. So welcome to this Health and Wellbeing Board, Thursday, 28th of July. It's good to see so many people once again in person here. I know we've got a couple of people online. It would be probably useful when you speak if you can say who you are and the organisation you represent, mainly, again, for those people online, because it's really difficult when you're sat there. You can see the screen, they can barely see us, so that would be useful. So without further ado, I'll go on to the item 1 on the agenda, which is minutes, to confirm the minutes as a true record. Is there anyone that was here on Thursday, the 28th of April, that would like to confirm those as a true set of minutes? Thank you, Michaela and Councillor Ian Stevens. I'll just sign the minutes. Okay, and when you speak, if you can bring the microphone as close as you can and speak very clearly into it, that would be useful, because otherwise people on the screen can't hear very well. I'd like to see if there's any declarations of interest, please, for today's meeting. Anyone online? Councillor Karen Lucioni.
In my other hat, I'm a PA on the PA notice board.
Thank you. Are there any other declarations? I can't see anyone's hands up, so that's the only declaration. Thank you, Sarah. Okay, so we move on to item 3 on the agenda, which is public question time. There are no public here, and we have received no written public questions. And I don't think that there's any public online either. Oh yes, Diana Conyers. Is there any questions from Diana? Nope. Okay, so we move on then to item number 4 on the agenda, which is the chairman's update. A quick update. So the integrated care system, one of these lovely things that we have to do. From July 22, integrated care systems took on the responsibility for improving health and care for residents. It is also responsible for broader aims such as strategic planning for the area. The Hampshire and Isle of Wight integrated care system will serve a population of 1.9 million people in Portsmouth, Southampton, the Isle of Wight, and the majority of Hampshire. It's going to be a big system. The NHS was primarily set up to provide treatment for acute illness, but it now needs, with its partners, to deliver joined up support for growing numbers of older people and people living with long-term conditions. As a result, the NHS and its partners need to work differently by providing more care in people's homes and the community, and breaking down barriers between services. It's the only way we're going to get through this. Our systems are working ever more closely together to achieve an even better joint working, which is why we spend so much time here. Whilst the statutory transition took place in July 22, this is built on the work we have been doing together over the last few years. And as an ICS, we will continue to engage with our partners to find out how we can best work together, identify key areas where joint working will have maximum impact, and at the same time, design simplified governance, I'm all for that, and the decision-making structures that suit us all. I think, you know, and another thing is about the continually saying about people preparing for old age, so that there's preparation and stuff. I don't know, it's what I've done in my life. Anyway, okay, so without further ado, oh, sorry.
Just in line with that, we might need to think about the terms of reference of this board in light of the other board. So we'll do that together and make sure that the terms of reference are reflecting the new system.
Good point. It's a good job you're on the ball. Thank you. Okay, so item number 5 is the health and wellbeing strategy, which is pages 11 to 38. That's you, Simon. Debbie?
Right. Sorry, Leader. Am I allowed a question on the chairman's report?
If you need to.
I think it might be helpful. Moving forward, in terms of the integrated care system, will that give us greater accessibility to all the facilities within the service? I know that as part of the acute services redesign, at that point in time, about 4 years ago, it was determined that 89% of our services would remain on the island, 11% going off. My other question is, in terms of care closer to home, we know that there are benefits to that in terms of people's mental health and staying healthy for longer, but there is actually a cost to that. So are we confident that we can balance that out with care closer to home as opposed to, for example, care homes?
Very good question. And we'll come on to this a bit under the last item on the agenda under the Better Care Fund. So 2 answers to your question. The absolute basic underlying principle, and I think I've talked about this 3 times in this building this week, so it's really good and it shows we're doing it in action. The basic underlying principle of the Integrated Care Board is that we bring health and social care closer together, and we jointly pool as much of the spending as we can to get the best outcomes for patients. And when Simon made reference earlier to the new governance structures we'd need to set up, that is exactly what we're doing to try and make sure that we collectively, together as a group, can move to the place where we get the absolute best value out of every pound on the island by pooling things together. In terms of your specific comment around partnerships, so same principle would apply. So yesterday at the Island Health and Care Board, which is another governance structure that we have together, and the chair was there in the meeting with Michelle and myself and Simon and many colleagues, and Councillor Love, who's with us today. We talked about the community and mental health partnership development with mainland services to make services as sustainable as possible on the island. And next month we'll be talking about the acute partnership, and all of those proposals will be coming through here and we'll be developing them jointly. So that is absolutely the principle. I think what I would say is it's really easy to talk about integration, isn't it? And it's really hard to achieve it. So I don't want people to think that that is an easy thing to do. But what it does do is give us the legal and statutory framework to start pooling more funds to do things together. Is that okay?
Thanks. Ooh, that was quite loud, sorry. Just to point out that the fundamental principle of an integrated care system is actually the importance of place. So within the integrated care system, I think there's 5 places, the Isle of Wight being one of them. And one of the successes of commissioning is actually we did commissioning in response to our local population needs. And as you rightly, as the chairman has already pointed out, that the integrated care system is going to be looking at, you know, millions of people, and actually a lot of what they will look at, they'll look at you know, over the system. So there will be a few areas which will be better done at system level, but the principle is that 80% of services will be commissioned and designed at place. You know, I see that when I believe it when I see it. But I think at presently, I'm pleased to say that I am actually a board member of the integrated care system. I had to apply for a post. I represent primary care, but in my interview, I very much said that I would be representing the island, and with the island focus. I'm very much island focused, and it was accepted that actually I am the only person on the integrated care board from the island, so I will definitely be waving the island flag.
Thank you very much. Okay, so we move on now to the health and wellbeing strategy. Simon, over to you. Thank you.
I'm hoping Marie's going to help with magic on the screen, just so we've got some slides. I was going to spend a bit of time on this strategy. We've talked about it for a long time. We our health and wellbeing strategy ended in April, and we need to have a new one. As it's kind of getting onto, oh, there we go, it's on screen now. Thank you, Marie. I don't know if I can click or if you're the clicker. Brilliant. This doesn't cover everything. This is about the things we want to work on together, just with Councillor Andre and Steve. It doesn't focus on children, but we have a children's trust plan which does all that. And I think it's how we connect those together and make sure there's maybe an annual conversation here about children to make sure we've tied that together. But I didn't want to almost make it everything for everybody. As we talked about yesterday, we had the ICP and the health and care plan, so that does other bits. So in this plan, I've tried to focus on the things we want to do together that improve the health of the population. I've called it healthy places for healthy people to live healthy lives. So I think that's what we are trying to do for the Isle of Wight, and that's what I believe we should be doing. If you go, I won't go through all the slides because that really is the strategy, but really on the next slide, in each of those, I wanted to focus on some specific areas that have been highlighted by the JSNA needs. Housing is a real issue. We just talked about that in council meetings. Here, our role is thinking about healthy housing. So the real links, because actually we know there's a benefit. So I'm not trying to step on others' toes again, but making sure we can be a critical and supportive friend to that agenda and really help develop healthy housing, warm housing, safe housing. I focused on mental health and emotional well-being in the pandemic. We saw the real impact of particularly of the lockdowns on people's mental health and well-being. So a focus on those areas. Probably across the age group, but mainly because we've got other plans doing things like CAMS that focus on adults there. And then we've all talked about inequalities and that difference between those who are better off and those who are worse off in their health outcomes, but not just poverty. There's many other things that impact on health inequalities. Maybe that's someone's protected characteristics, so we're thinking about those. The next slide just highlights we're aligning with the health and care plan. And Michelle, I know I can see her on the screen. It's been a journey together to make sure that they're aligned, crossed, and working together. And we are planning a joint launch so that actually we can show the totality of what we're doing and it brings that together. There's a little bit about the needs of the population. We want to take a place and people-centered approach and a data-centered approach. That's slide 6, Marie. Population health management is something that the ICS has a mandate to do, but actually for me that's about basing our information on data. I think sometimes traditionally we do what we think is right rather than actually what the data is telling us. We're just basically saying we'll take the data. So the next slides really focus on what we're going to do in each of the areas. So slide 9 is focusing on the healthy homes and what we're going to do there, thinking about affordability, quality, security and homelessness. And there's some actions there. Slide 10 sets out the actions. Oh, sorry, can you click through? If you click through. Oh, okay. There we go. Magic. Oh, back a bit. You go. The blue side of my attempt, quite poorly, to indicate a new chapter, but clearly I need to do something different about that. If you just go back, can you go back? There we go. So we want a systems approach to housing. We want to champion excellence in kind of standards. We want to think about home safety, working with the fire service, and we want to think about that link to climate change and how we improve the things there in our housing that can improve both housing, climate change, and improve the health of the population. We've got some indicators which we need to work out, and we'll talk about what we're doing there. If you move on to the, keep going through, and the next one, and the next one. So for healthy people, what we want to do is think about our mental health alliance. We've got a really strong mental health alliance that looks at both promoting mental health and well-being and suicide prevention. That complements the work that's being led by Leslie Stevens in the Trust around mental health services. So it's really trying to be distinct about what we do here rather than what we do, and it's kind of a complex piece. The Office of Police Crime Commissioner, her deputy's not here, but they're taking a trauma-informed approach, taking some work around that really thinking about the impact of childhood trauma on someone's life. We know it impacts on mental health, we know it impacts on children's well-being and those things. So we're supporting that, but really trying to put a health lens on that. We want to think about service improvements, and that's really the work that Leslie's leading. And also our workforce is really important. We know during the pandemic, the workforce is highly impacted by the impact of mental health. So what do we do within the council, within the trust, and with our organisations? We have really good work on mental health and wellbeing for our staff, but how do we broaden that out in the voluntary sector? Actually, how do we make sure that all people working on the island can have access to things that improve their mental health and wellbeing? So the final section about inequalities, if you move on, it's slide 20, I think it's 4 slides on again, which says what we are doing. Next one. There we go. So tackling health inequalities, I think, is key, and it's really complicated. And we've thought a lot about how to do this. So we have got the healthy food and activity program there, which is really good. And how do we make sure that really meets the needs of the whole population and expands in its remit? We're thinking about the Healthy Hearts program, which is a cardiovascular disease program focusing on those most at risk from cardiovascular disease through primary and secondary prevention. And we've got a program in the NHS called Core 20+5, and that's focusing on the most deprived people in terms of deprivation indices, but also key areas, and I'm going to forget them all, but maternity, coronary vascular disease, people with mental health problems, and 2 others. So that's the NHS program, but we want to make sure we oversee that and bring that. Michelle will probably correct me and make sure I've got that right. We want to tackle poverty. I know Chris Ashman and I have talked about how we do that. And I wonder if this group wants to really think about how we tackle poverty in this together and work really closely together. What can we all do to tackle poverty? And then really supporting a healthy lifestyles. We know that people who are more deprived and more challenged in their lifestyles find it harder to have healthy lives. So we're trying to focus our services on those people. So just finally, what we're going to do is, following the sign-off, is work with a small group of people from organisations to work up the indicators, which we'll bring back here on a regular basis, probably quarterly, but maybe 6 months if that's more appropriate, if the indicators are slow to develop, with some process indicators underneath that, so that we measure success in terms of both what we're doing and the outcomes we're trying to deliver. I listed a couple of strategies at the back that's connected to it. I'm sure there's some more. And Stephen, where you've had a bit of a staff change, that's why I haven't got the Children and Young People's Plan link in there. I just need to connect that in to make sure that Young People's Plan's connected in. So I think that's where we are. I can see that the chair has got lots of notes for me to update, but that might be as we do an implementation plan, they may come through that. But welcome any comments on how on this strategy, and then hopefully people will be able to sign that off so we can move forward.
Yes, I did read every page and I did make copious notes on all of them. But I will open it up to everybody. Are there any comments on this? Are there any? Councillor Love.
Thank you, Chair. I just wanted to thank Simon and his team for all of the work that they've done in putting this strategy together. I can certainly see from Simon's efforts here that he's certainly listened to a lot of the comments and inputs from the meetings, but through our discussion. Of course, we're strengthening poverty and deprivation within this new policy, and I'm really pleased to see that mental health, that equality, diversity is all included within this document. So thank you for that, Simon.
Okay, thank you, Councillor Ian Stevens.
Thank you, Chair. Noting the weight that is given to housing, and noting the Alliance Administration's corporate plan and our support for housing, as the Cabinet Member for Housing and Homelessness, and indeed poverty, I haven't been approached, either informally or formally, to take part in meetings. I note that the Director, Simon, you met with or spoken with Chris Ashman. Chris Ashman is Director of Regeneration. We have a new housing manager in place. We have other people that at this moment in time in disparate areas of our organisation which support various housing elements. And I just think that whilst you lay a lot of importance on housing and homelessness, rough sleeping, you haven't come and spoken with myself. Now, we know, and I've got, as you're probably aware, I've been in front of scrutiny twice. I've been questioned at full council with reference to this. I've given honest statements of where we are with our housing situation. If I was happy, I'd be saying I was happy. How can you be happy or satisfied? And this is not a reflection on the officers. This is a reflection on historically the way we've worked, the pandemic, the marketplace, cost of materials, and indeed, if you like, looking at where our affordable housing is 80% of the purchase price, and what we want to do with the island plan is getting it down to 60, 62% at the most. So we've got problems on the island. And I would like to say that I'm here. I come in most days into County Hall. My email address is there. My mobile address is there. And I do feel that what we need to do is you say you've got an action plan. That's great. I'd like the action plans to marry up, see what we're doing corporately in our organisation. I'd also like to see what the board that met yesterday morning is doing or looking to do to support our housing situation on the Isle of Wight, and indeed our poverty, how we're alleviating ourselves from poverty. I hear a thing about hubs and what have you. The voluntary sector group, I volunteered to go and meet the voluntary sector group. We'll go and sit on it. I was told that it was not a place for members. Don't attend. I haven't attended. So I'm just putting out there, and I've got plenty of information here. Indeed, I've got the corporate plan here. I've got everything because I see the importance of supporting those with housing problems so that we can keep them in their own homes. I see the problems of people being moved on because the various owners of property want to change the use of their property, so they're moved out. And I see the assistance that we can give them, which is at this moment quite limited. And we're trying to expand that. I want your help. I want your help. You know, and bring it back to, okay, let's make it people centered. Thank you.
Let me come back. Councillor Stevens, you're right, and we've discussed this strategy over the year in this board to kind of develop the plan. So that's why they are at this stage. And the reason we have selected health and housing is because absolutely saying that, you know, I recognise the importance of the issue from both the availability and the kind of infrastructure side, which isn't this role of this board, but also this board is around health and wellbeing. So colleagues around the table will want to be part of that. So that's why we brought it here. And that's why I feel the health and wellbeing strategy should focus on the health and housing links and make those clear. And so that's what we try to do. But this is the starting point to then develop action plans, as you say, to dovetail with other action plans that we've got around maybe about employing people on the island, and if we're trying to employ more nurses, and how do we, you know, the key work housing, those kind of things. So it's absolutely central to that, and working with the leader here to make sure that they are all dovetailed together with corporate plan and the priority of the Alliance.
Hey, thank you. And oh, sorry, Amanda.
Sorry, thanks. Just on the housing point, I was just going to say before Councillor Stevens obviously said about housing, can we reference the housing strategy? Because I don't think that links in there at the moment. And really happy to sit down with your team to talk about the housing health and safety rating system and how we can get some of those features in here, because it does seem to be quite heavy on well, obviously fuel poverty comes into it and the energy efficiency of properties, but we deal an awful lot with those property standards. So if we can tease out some of those items. I think that'd be really useful. Happy to sit down. Yeah, happy to sit down and discuss it.
Councillor Love?
Sorry, I was just going to come back to support my director. You know, we spent significant amount of time talking about housing, poverty, fuel poverty, and a whole range of things. And I welcome the comments that have been made, but we have spent quite a lot of time going into those things. And I can assure you that they're very much on the agenda for our public health and other areas of our team's work.
Thank you very much. Jill, did you want to come in?
Thank you. Just what we've noticed, particularly working in the community at the moment, is the lack of recruitment, particularly, I think, in care homes across the island. And we've also noticed a link with housing. So I live in the West White, and families are having to move, families who are renting possibly, are having to move out to find cheaper rents at the moment. So we're having this sort of double-edged problem at the moment, because without the staff, can't do the work, can we? And I'm just wondering if you've got plans in place for that. I know care homes in my area are really struggling, and in the community.
As we know, there's a nationwide shortage, Jill, of staffing across the country. I think yesterday it was 60,000 vacancies within the NHS, and of that 39,000 was nursing staff. So there is a massive shortage. It's strange that you should mention it, because on almost every page I have listed the issue around staff. What I would say is that the meeting we had yesterday with NHS people, it was quite innovative the way the mental health team had gone and recruited from the Isle of Wight College, direct from the Isle of Wight College. They did it in a certain way. I'm not quite sure how they got into that or how they worked. I don't know if any of my other colleagues know, but they actually went in and there was 35 pupils or children, or no, I suppose the young adults now, that were going to go in, and they did different scenarios in each room to see how those children reacted. Of that, they're going to recruit 25 direct from there that they can then pull on to see how they progress further. And I think that's the secret, is to get in to the college at that time to see, because, you know, it's not a job, caring, it's a vocation. It truly is a vocation. And so I think, you know, there's some people that are designed to be that caring person. So there is this work going on, but I don't know if anyone else wants, Michaela wants to come in.
That's really good to hear. Some of the problems that we've picked up now is petrol costs, because not all carers get paid, and only because I've been looking after an elderly lady, and they're thinking that they may not be able to continue, and I wonder if there's anything we could do to help with that.
So I'll come in on that. It's really good for you to flag that. And in every discussion we've had this week, in fact every discussion I have permanently, workforce and the challenges around recruiting and retaining workforce is our number one challenge. It's the number one challenge in the country. It's specifically number one challenge on the island. In terms of the question the councillor asked earlier in the meeting, our clear view, I think, as a set of partners, is that integration, one of the big opportunities of integration is around workforce. So at the moment, it is actually even more challenging to recruit social care staff, specifically in the community, than it is to recruit NHS staff. So one of the really early things that Laura Gordian, who can't be with us today, but her team and my teams and the trust are talking about is, what can we do together to try and recruit staff collaboratively in a way that gives them better conditions, essentially. And that's a lot of that is about pay, but a lot of it is about the team around you, things like petrol costs, and coming together to try and support that. And I think that has to be our number one priority on the island. So we're actively working on that. The petrol cost thing for community staff is coming up again and again and again consistently. And nationally, they have not moved the payment model. So Agenda for Change, which is, sorry, tedious terms, but essentially NHS payment scales are set nationally. And at the moment, we are not allowed to move the payment rate, whatever we might think about that locally. And every system is in the same place, but there is a national discussion going on about should that happen. But we do absolutely recognise that, and it is the number one thing that's in the island health and care plan, is to sort out workforce.
Mark wanted to come in. Mark.
Just really adding to what Michaela was saying in terms of the work that I know she's doing with Laura in relation to recruitment. We are challenged in the island in terms of recruitment, and we can look at various groups, but I think the main group at the moment sits around the vocational area, the hands-on care element that fulfills community-based services, which is almost fundamental to supporting our vulnerable people in the community. But also within our homes, it's also supporting people within our bed-based care and ensuring that they are supported. And I know there are struggles there in terms of care staff actually being there. The second tier, what I'd call the second tier, is our professional groups. Clearly, we do need professionals to come onto the island, and we have struggled across adult social care in terms of recruiting particular professional groups, mental health in particular. Currently, we've got 3 AMP vacancies, those qualified, warranted to do mental health assessments, currently supported through agency staff. But we need, I think the key message is we need to grow our own. We need to invest on this island, ensuring that we grow those opportunities for people on the island to become professionals that support our whole system. And the final thing I would say, which goes back to what Michaela was saying, was around the opportunity under integration. I've seen this in other authorities where you look at integration opportunities where you can give those hands-on carers a really positive deal in terms of enhancements, not just about money, but just the quality of their environment and how they work. And I think, you know, the key thing here is it isn't just, and whilst people may say it's always about money, no, it's not. It's about what we can offer to people coming to this island. What's the deal if you work for the council, work for a health system? All the added value, the environment, the schools, all of that's the whole thing we have to sell. Thank you.
Thank you. Are there any further questions or comments on that paper? Councillor Love.
Thank you, Michaela and Mark. I mean, Mark articulates the effort that we've been putting in to recruitment and retention quite accurately. I think it's important to also state that you know, it's also about money from government, and the government promised to fix adult social care, and we still haven't received a penny from government in order to help us do that. And it's really important to remember that whilst we would want to support our workers in terms of fuel costs and other issues, and we will try to find ways around that, the fact is that, as Michaela has said, that in actual fact we've still had no funding changes and resolutions to what we can provide and what we are able to provide, and that is causing us a great deal of difficulty. But on the positive side, we had a recruitment day with the Ukrainians just a few weeks ago, where 50 people came forward looking for jobs, and they're going to be repeating that fairly soon. So we do have the potential to try and get some additional capacity into our services, but it still remains incredibly difficult right across the service. And our workforce strategy, which we're working with our NHS colleagues, is very much at the centre of that, and I thank them for their participation in that. But ultimately, the government has to give us more money so that we can do what we need to do, and then we've got to find a workforce, which of course the money will help us do.
Okay, thank you. There are no further questions or comments, so thank you, Simon, for that paper and the continued conversations.
So can we approve the sign off and move that forward?
Are we happy as a board to approve and sign that off, please? Could somebody indicate? Councillor Love? Councillor, yep, okay. Thank you very much. Thank you. Okay, so we move on to the following paper, and what I should have said is there are a number of key people that actually aren't here today, and I know that they're quite unwell, and our thoughts and best wishes are with those because we miss them sorely in this meeting. So I should have said that at the start. So Michaela, you're going to do the next paper.
Michelle, yes.
Oh, Michelle Young. Oh, sorry, I thought it was Michaela. Oh, she's gone.
Where's she? She's there. Look.
Oh no, she's on that screen. Sorry. We've got too many screens in the room. I'm looking at that one, and you're definitely not on there. Oh, thank you, Michelle. So you're going to take the paper in place of Laura. Thank you.
Thank you. So there's not a huge amount more to add from what Simon has said. We've worked really hard over the last 12 months in ensuring that we're integrating the health and wellbeing strategy and the health and care plan for the island as much as we possibly can. And we're aiming to do a joint launch of both of those documents in September. And we have a smaller working group that will be developing that over the next few weeks. As part of the papers for this board is the public facing document. So the final version that this board had asked for me to bring back. We have responded to lots of comments that we received from last time we came to the board, and indeed from the Health and Care Partnership. So hopefully everyone is happy. It was received well yesterday at board. We did have agreed from board is that we would develop an easy read document, an LD version and a version for those that are visually impaired on the island. So we will work on that over the next couple of weeks. We also agreed that we would have an annual refresh of the data and ensure that key messages were circulated so we can keep track as things do change on the island, and a commitment to return to the Health and Care Partnership Board quarterly with updates of how we're progressing with the plan. So I'm more than happy to come back to this board so that you are sighted on the progress that we're making. We do need to firm up some of the governance around the plan, but we're well on with that. And I think come September, we'll have that firmed up. So hopefully, if you've had a chance to read it, everyone's comfortable with the narrative within that public facing, but please be mindful that there will be an easy read document that will run alongside it. So I think that's probably everything that I needed to say. Happy to take any questions.
Okay. Thank you for that, Michelle. Sorry, I thought it was Michaela. There's too many Michelles and Michaelas, aren't there? And two Lauras as well, usually. So it does make for complicated. I think it was a fairly easy read, I have to say. I didn't find it overly, but I would like to highlight a number of things, seeing as we have our lovely media lady here today. And you know, because I really feel publicly that we need to keep on about the preventative of ill health. I mean, I know I'm overweight, but you know, it's about this preventative and trying to be as well as you can, because when you see that we have the highest proportion of people in England aged 65 and over, you know, almost 30%, and that 65% of those residents have 2 or long-term conditions, and that people with those long-term conditions account for 50% of all island GP appointments. And they also account for 64% of all outpatient appointments and over 70% of all inpatient bed days. And I just think that really, you know, sort of hits home to us, the situation that we're in. I have raised again on that page, which was page 49 of this, about, you know, where we will get the staff from. And I think we should be inspired what Leslie Stevens has did with the Isle of Wight College over that. You know, that nationally, you know, 22% of deaths are avoidable. And when you go through death and the grieving process, it has a long-term effect, which you were talking about, the trauma, you know, that has that knock-on effect with people. And I just think it's very important. There was a lot of stats, and I agree with you, Michelle, that you must keep those stats, you know, refreshed and up to date, because I think it's very important. The dental services, there was just the one small bit about the dental services, and we know again that needs to be really pushed to the forefront. You know, I mean, I've been banging on about that, I think, since 2006. What I would say also is on page 52, it says the trust has an operating deficit, the financial cost of providing services. This is something that I will be taking if we have a government still in place, or whatever's going to happen. In September, I'm supposed to be going to this Island Forum. This is the sort of thing that I need to take with me so that they understand you know, that have the difficulties of being on an island. You know, some of us, my family have been here since 1753. It's not that I can just lift up and move away from my roots and my history, you know, and there's a lot of us islanders here. But we need to be acknowledged, the Isles of Scilly's are, and Scottish Isles. Why is the island left out? So that is something that I will be raising. The dentistry, I think, Michelle, you said we will try and do a little bit more about that, because it is critical on the island, as we know. Councillor Debbie Andre, or
Debbie, you can't.
Thank you, Leader. Just a point of clarification. I note that on page 49 of the plan, the 2021 census is used to give the 29.3% age 65 and over, and yet on page 16, it's 28.7. Now, I appreciate that obviously using different data sets, but is there any sort of plan to sort of ratify those data sets? Because it can be, especially if this is going to be a public facing document, I think perhaps we need to level the two.
Michelle and I have tried to tie together our data sources, but Michelle, we can pick up outside and just make sure we're, and I think we did pick up one of them, so let's check that one and we can do that.
Yeah, that's great. Thanks, Simon.
Councillor Love.
Thank you, Chair. I mean, this weekend highlights just how important our prevention strategies really are on an island when we've had a critical incident that's occurred, and how important it is to try to prevent the pressures occurring on the front door of our NHS particularly. And so clearly we can see a much stronger emphasis coming now from government about preventative work, but it's so important on an island that we protect our hospitals and our GPs from that pressure as far as possible by increasing our output and our energies into prevention. You know, if we can't have a hospital on the island which unfortunately did this weekend go into a critical situation, and prevention for me is the key in being able to look at that front door and what it is that we can do to both redirect people to the appropriate services using 111 and all the other stuff. The great news about this weekend was we have heard just how well our ambulance service performed in addressing those really quite serious incidents. That's come as a result of additional work for COVID and for heat, and just a general increase. So prevention is going to be really, really important, and all the messages as we move forward into the winter pressures. So I just wanted to again reiterate that Simon's team and Simon's work now, it has been really critical during COVID, and is again at the forefront in terms of moving us forward to try and avoid any winter pressures by improving our prevention services.
Thank you. Councillor Stevens.
Thank you, Chair. Couple of points. First one is within this document, which is very readable and very well written. There are elements there which point out concerns, and I won't say failures, but point out there's a need for activity. Yet the response is the activity is such and such, but there doesn't appear to be any reference to how that's going, how future work alongside projection is going to be shown, whether it's next January or what have you, as to what the response, how the response was received, was it successful, and on what dates did we achieve certain elements. So that's the first thing. Do you want to respond to that straight away?
Yeah, yeah, of course. I'm happy to do that if that's okay, Chair.
Yep, that's yeah, okay,
Okay.
Michelle.
So what I should have said at the beginning is this is the public facing document. We also have a detailed pack that sits behind it that has what we term as being the SMART objective. So it does detail what our ambitions are and the timeline for achieving. There are also delivery plans that come alongside each of the programmes of work that are mentioned within the health and care plan, but we've simplified it as much as possible for the public facing document. But as I say, that there is a detailed document that sits behind it.
Thank you, Michelle. That answers that, and you know, I'm totally satisfied with that. Obviously, great stuff. Can I just mention, and I know that both Simon and Carl are on top of this preventative area. You know, moving forward, rather than dealing with the aftermath, dealing with the a possible cause of the situation. So they did that in the fire service, and they cut down on the number of fires. I'm saying this because I was chair of a national fire board for the LGA, etc. And throughout the land, we cut down on the emergency side. Fire call outs were suppressed and gone away. And then they said, okay, you've got to cut back because you haven't got the number of fire incidents and call outs that you had previously. So fire authorities throughout the land cut out their fire prevention officers because they're not going to cut out the people at the cutting edge. So fire prevention officers went. And I'm just pointing this out as possibly an anomaly that might come forward with health. You cut down on the acute side because you're doing prevention work, and then suddenly, because you haven't got the acute side and you haven't got the cases coming through the door of a GP surgery or A&E, suddenly people elsewhere say, well, you can cut down on what you're doing because you're a success. Well, we've got to make sure that this does not happen with healthcare, and take the consideration of what the levels are at this moment in time before you start, let's face it, progressing even further down the line of prevention work, because sooner or later some bright spark up in Treasury is going to say they can cut that. So that's just a word of warning. And I would say that the Fire Authority and Hampshire and the Isle of Wight Fire Authority, as Councillor Lucioni will know now, are only too pleased to assist with our social care and you know, both children's social care and indeed our adult social care and community safety aspects to make sure that people in their homes are safe. Thank you.
Thank you. Rachel. Rachel's from Age UK, for those online.
Hi, with regards to the prevention agenda, I mean, I think and the data given the ageing population and the expected increase in currently termed age-related conditions, I think that prevention has got a really important part to play. You can't prevent ageing. However, you can prevent the development of long-term conditions and certain conditions. But one of the things that's absolutely at the heart of that is actually challenging the notions that we currently all hold about aging, and that as we age, we're going to get aches and pains and issues, and we just accept that, and then we moderate our lifestyle in accordance with it. And I think there's a real challenge here about how we actually reframe aging from a story of growing into decline and wanting to grow into an alternative way of living our lives. And just to raise that, to support that ambition, the Aging Centre for Aging Better have just appointed Jo Lachlan, who some you might know, she led on the Time to Change programme, which was around challenging attitudes towards mental health and wellbeing. And she's going to be leading on a campaign challenging those ageist attitudes. And age is a characteristic that's protected. And it's one of those things that does, you know, unfortunately, you know, prejudice people with regards to their health outcomes, but unfortunately we as individuals hold part of that problem in our own heads and thinking as a society.
Well, that was a good point made, I have to say. You see, when my knees started hurting, I went from a house to a bungalow and all the pain stopped. But maybe that's the wrong attitude to have. Maybe I should have had staircases and carried on keeping fit. Hey, Karen Lucioni, Councillor Lucioni.
I just wanted to back up Rachel, because I have clients, as I said in my interest at the beginning, and a lot of elderly, although I don't really see age, maybe there's some other people do, I don't see that, but they certainly say, well, I don't get as much care because I'm older, and they feel that. So just to be aware of that.
Sorry, just to add on that, it is things like we say, I can't go to the gym because I'm too old. And actually that's not usually the reason. The reason is I can't go to the gym because I'm really unfit, or I can't go to the gym because I'm overweight, you know, but we substitute those for age, and societally we accept and embrace that.
I agree, very good. Steve Crocker.
Thanks, and sorry I can't be with you in person this morning, but there's a couple of things I just want to say on this report. Firstly, obviously it's a good report and a good summary, but perhaps one of the areas I think it could have been stronger, and perhaps the committee might want to emphasise this, is around children's mental health. And both nationally and locally, I've been banging the drum on this point for quite a while, and it's clear that coming out of the pandemic, both locally and nationally, children's mental health has suffered, and we have more children being referred to children's mental health services. Now, it strikes me that yes, it's really important to talk about age and ageing, but I think we also need to look at the other end of the telescope, and we need to encourage the new ICS to place children's mental health at the heart of what it does, and that it should be one of their top priorities for the next few years to help this next generation come to terms with what's happened to them in the pandemic and to thrive in the future. So my plea to the Health and Wellbeing Board is that we should perhaps write to, as we have done in Hampshire, to write to the incoming ICS board to say that we consider this to be a priority for the new ICS.
I don't like to say I'm one step ahead of you, Steve, but I am.
You're always one step ahead of me, Leader.
I've sent a copy of the letter that Hampshire sent so that we can do, hopefully replicate with the board's support, so that we can replicate that support. If people will recall, when the Alliance administration got in and I had to do a speech at that very first meeting when I was elected as leader, I said that I wanted us to come out of COVID mentally, physically and financially stable, and that was my priority, along with the housing issue, and that has remained. I didn't want to rock the boat. I think we're in a vulnerable position with COVID still hanging around. The repercussions of COVID will be here for the next 5, 10, or if you know, you could look at the money that government has gone out and hocked us up to the hill. You know, it could be, you know, another 100 years that we're still paying back the debt of COVID. But the priority is to mentally come out of COVID well. So, and that meant across the board. That meant all ages. That was not, there was no age difference there, and that was absolutely one of our things, financially, mentally, and physically, because we know, you know, that for 18 months people weren't getting the treatment that they needed, and the repercussions of that. And that is still a very strong priority, certainly of me, of the leader, and I hope of the Alliance would still be behind me and supportive of those aims that we put in the start. Simon, and then Jim.
Steve, I think that's really helpful on page. I think you're right, in the document, it kind of says mental health is important, but doesn't really specify children. And I wonder if you can just explicitly say that, otherwise it's forgotten sometimes. I think there's something there. Yeah. And one of my other points, I wonder if you can just clarify some of the language. So we talk about primary care, but what do we mean by that? Because that should include dentistry, pharmacy. So it might be helpful just to talk about that, which may start to help address some of those issues. I think it's great, but a little bit of tidying around the edges.
Just a quick one to say, we're talking about people over 65. Those people over 65, we wouldn't have survived through a lot of the work that happened during COVID, because they are the people that are running so many things now in my area, in the West White. There's, you know, we set up Our Place. We've had to do 2 more now because it's so popular. So we're working in our community to have something that people can just drop into, but that is being run by most people who are over 65. So they're assets, aren't they? I think we need to look at them as assets as well, and some incredibly keen people doing some really good stuff. So yeah, so look after 65-year-olds.
Well, that'll be me soon. Hopefully somebody will be looking after me. What I would say is, as I've mentioned numerous times again in my speeches, that if we didn't have the voluntary sector on the Isle of Wight would come to a standstill. And most of those people that run the voluntary sector are people that have either retired to the island or are retired. They suddenly decide after they've done the house up as they want it, they're a little bit bored. And that's when we get them into joining a number of associations, and so I know the vital importance of that age group, because the island would come to a standstill without the volunteer sector. Mark, oh sorry, Jill.
Currently doing a holiday club for children, and we know that some of those children will be children who will be used to having free school meals and won't be getting them. So through that group, and it's just fun for the children through the school holidays, providing food and meals as well. So it's both ends, isn't it?
Thank you. Mark?
Thank you. Just a couple of points I wanted to raise. Obviously, this is a comment on the actual document itself as a quality document. It's got all the detail and it's really helpful. I'm picking up on Steve's point about dealing with the younger people in order to manage the generation that comes through and how we deal with those issues in terms of mental health, as well as dealing with people in adulthood with challenging situations because of the aftermath of COVID and other things in their life. But one of the key things that occupies my mind at the moment with these sorts of approaches is the quality of the engagement with the people out there. By that I mean their full and comprehensive understanding of the challenges we face. Unless they have that understanding of it in the way they need to, then the system has the potential to creak a bit and be challenged. And thinking about GPs aren't going to fix everything. They can't. It's not possible. Part of the deal is how we help fix ourselves and how we set up a handshake on a deal about how we're going to manage the next decade in terms of the challenge we face with either long-term conditions, poor mental health, addictions, alcohol, all of that. We've got the data that tells the story. But I think it really matters that we have that open and clear discussion with people out there today in understanding what we're trying to do here, without which we won't achieve as much as we really should achieve with the data, the information that we're trying to do. That is true prevention. And I think we have to really focus down on that in order to make this have an impact for those people on this island. I think the final thing I wanted to say was picking up on, you're absolutely right, Jill, I think it was, older people are the backbone to some extent of supporting people through their lives. I was in Costa this morning watching a mother deal with a child who was incredibly disabled, but actually great that she was there in that space, living her life and feeling supported. That mum does that every day, because I see her in there every day, like many, many parents, as well as older people supporting others in that way. So family carers, informal carers, let alone our own formalised care, is a massive infrastructure. And without that, yeah, absolutely, this island would collapse.
Thank you. And I very much agree with Mark that there is this strong element of personal responsibility, but I think also we can't underestimate the intergenerational benefits in terms of our children. I mean, there are lots of programs actually going on whereby children are actually learning things at school, they're learning how to look after themselves, and that's actually following through. And also there are benefits of, there's several programs where children are actually connecting with local care homes, and the benefits for both are very strong. So I think not to underestimate, yes, there's a focus on the older generation, but I think by bringing in, looking from both ends of the spectrum, as it were, there's a lot that can be achieved.
Which is, I think, what Jill just said about the over 65s running a children's club during the summer holidays. So that's marvellous. Councillor Love?
Yes, thank you. I think that quite a lot has been really said about how important our care sector is, and the informal carers, people looking after their loved ones after many years of being together, and how they will struggle on and trying to identify their needs early, so that we keep the partners of people who are well, who are basically aging not as well as they could do, and our services there. So we are indebted to them, totally indebted to them, and that's why we've been looking at the frailty pathways that we've been talking about developing on the island with our partners. It's absolutely critical there, but without those volunteers and those they don't actually see themselves as volunteers, they see them, as Marcus said, as partners looking after partners who are trying to age well and struggling on to the end, rather than actually early intervention, which then helps them to move forward. That's part of the area which we're trying to address through our Living Well programs and so on. But absolutely critical, and that they're part of this this care pathway that we're trying to enhance. And of course, again, we all know that there are some blocks within that in terms of resources, but generally speaking, we're actually doing quite well on the island with that, because of the value that we've got in those voluntary partnerships. Thank you.
Thank you. Michelle, thank you so much for a report. I agree with Simon about the primary care. You know, people, if the public were to read this, they wouldn't even know what primary care actually meant. And I think, you know, using that different language on that point, an average of 1,184 primary care appointments are not attended every week. I think that's a pretty sad statistic when people are in such dire need. But thank you very much, and I thank you also for definitely taking on board Health Watch. If anyone is at the heart of what is really going on every day in people's lives, it's Health Watch. They're the ones that get the phone calls, they're the ones that know what's really going on. So thank you very much for adding that. So without further ado, are we okay that we adopt this plan? Yes. Or receive the plan? Everyone happy with that? Yep. Okay. Thank you very much, Michelle. So we move on quickly to item number 6 on the agenda, which is the Better Care Fund. And that is definitely Michaela, isn't it? Yes.
That is definitely me, not Michelle, not the other Michelle. Definitely me. Thank you ever so, Chair. Just in terms of the purpose of bringing the paper here, just so I can be really clear with people, we're looking for 2 things here today. The first is to provide you an update on the Better Care Fund, how it's been spent, and what's been happening over the last 2 years. And some of that is linked to COVID, which I'll explain. And also to get agreement just in principle for the approach we're taking forward around the 22-23 fund. And what I would say is, in terms of the earlier conversations, and in fact every conversation we've had in this meeting about the benefits of integration, particularly around things like children's mental health services, early intervention services, good discharge services, the whole gamut of community services, this Better Care Fund is the financial vehicle through which we can pool our funds and work together more effectively. So we have to get absolute best use from this set of funds. And that's why I wanted to bring this briefing together with Laura and Mark and colleagues who are here today. So thank you for
Okay, thank you for that. So could we please note, because of the Better Care Fund, that Rachel gives declaration. Amanda?
Probably better be similar because I received the funding for disabled facility grants.
There's 2 extra declarations of interest. Please do feel free to go up and get a pastry and teas and coffees in between. Yes, please do.
Just to confirm, what I would say is thank you to everybody for declaring their interest. There is no decision here today around changes to funding or funding being made, so it's not a situation in which you can't participate in the discussion. Does that make sense? I just wanted to reassure people that there's not a direct conflict. So for anyone who isn't clear on the background, the Better Care Fund is the model through which we pool health and social care. It's a very significant amount of funding, £40 million worth of ICB money and £11 million worth of adult social care money, so £50 million into services on this. So our ability to make sure we spend this money well, and we very specifically don't have duplication, and we get the right services for patients is key. There should have been an annual review of BCF spend, and the reason you haven't seen one for 2 years is that, like a lot of things during COVID, the requirement to do an annual review stopped. So there was no annual review. So what we've brought here today is the annual review for 21-22 and our direction of travel for planning in 22 and 23. I'm trying to summarise what is quite a lengthy paper, so I'll refer to the sections I am, and I apologise because I think there's definitely some learning. We talked about this yesterday about shorter briefings on some of these things. So when we bring this back next time, we'll bring a PowerPoint slide, Chair, which makes things quite slightly clearer. What I would say is that since April 2017, if you look at paragraph 10 of the paper, which is on page 68 of your pack, you can see there the 12 schemes listed, which are how we basically spend that £50 million. And there haven't been significant changes to those 12 schemes over the last 2 years, with the exception of 2 areas that I wanted to flag. The first one, which many of you will know well, was the re-procurement of the Living Well contract and a lot of the early intervention contracts, for which there are 3 providers across the island, and they're doing phenomenally well in supporting people around early discharge. And the second addition was around significant additional funding for hospital discharge schemes. So Carl will know well, and Mark and Laura and I, I was going to get a cup of tea. There's me pointing at Mark. No, you're fine, Mark. We've put in an additional £4 million last year around hospital discharge schemes and getting people out of hospital quicker. Despite that funding, actually, we still have significant problems getting people out of hospital, and that predominantly relates to all the staffing issues which we've all been talking about. We cannot get the staff in social care and out of hospital settings to move people out quickly enough. So that is what we have done. What I wanted to describe is the work that we're going to do going forward into 22-23. So there are a few things you should note. We've committed this year as the ICB to increase the fund by 5.7%. That's been the national uplift, and we've maintained that. So 5.7% funding from the NHS has gone in to increase this year. And you'll recognise I've only been in post 3 months, so we're kind of getting up to speed on this. But what Laura and I have jointly asked is that the teams, with all of the relevant parties, so most people around this table will actually be involved, the teams over the next 6 months work to review those 12 areas of spend and focus in particular on making sure that we're spending our money in exactly the right way on 4 areas. And I'm going to list those 4 areas to you, and they won't surprise you at all. They are early help and assistance, so things like living well and support to families, all of the stuff we've been discussing today about not allowing people to deteriorate and getting our prevention services right. They are discharge and regaining independence, so making sure that people who are discharged from hospital get the right support earlier, and actually so that more people go back to their own homes with the right support in place, because that's what they want. 3, community support, so the ongoing integrated mental health teams and community teams and all of the pilots we've got in community going. And 4, I'm sure Steve and everyone else will be pleased to know, the 4th priority is around mental health in its entirety, but children's mental health, specifically on the island, being part of that Better Care Fund. So they are the 4 plans they're the 4 areas we'll be focusing on as we complete the review for next year. The £50 million pot will not change going forward into 22-23, but our job is to make sure that we're getting best value out of every penny of that £50 million. And what we need to be able to do is, in particular, to focus the funds on the areas that we're taking through as part of the Island Health and Care Plan that Michelle was describing, and Simon's Health and Wellbeing Plan earlier. So there is a definite desire to try and target some of that money around some of those workforce conversations we were having earlier, and particular around the social care workforce support and how do we get there, the support to those staff right. So I appreciate that's a fairly rapid overview of actually what is quite a complex paper, but what I'm really looking for is for people to note the current plans and note and approve the areas of work we're looking to look forward to in 22-23. And we will come back here. I haven't organised with Simon a new chair, but I'm thinking what would be helpful is to come back probably in October, November time, depending on your next meeting, to just give an update on how the review's going, so that when we come back with a recommendation for 22-23, it's kind of not a surprise, if that makes sense. It only need to be a 5-minute item, but we'd keep you briefed.
Thank you very much. As you say, it is a rather large and complicated paper, but one of those things that comes up that we need to achieve. Oh, look, and she's been really healthy with a satsuma, and we're sat here with teas. Get teas and coffees if you want one. Rachel.
Sorry, to be slightly pedantic, it's just a point of fact in the report that you provided in Success 2. It talks about the Age UK GNS scheme being integrated into the Living Well service. I'm on page 89. Success 2, sorry. Yeah, the actual Age UK GNS scheme is still run by Age UK, but there is the community transport element and volunteering support that is run by.
Yeah, Rachel, that's very small print that you managed to read. Your glasses are obviously a lot better than mine.
Reading all of this.
Okay, so Simon.
Michaela, I'm just really happy. I think in the review, I'd really welcome think about how we can address inequalities as part of that. It's not easy, but I just wondered if we could have conversations to make sure addressing inequalities is part of the whole review and how we move forward.
Okay, so are we okay that we've received that update and with those comments on board? Yep, everyone's happy. Thank you very much. Okay, so we move on to item number 7 on the agenda, which is members' question time. We've received none and there are no members here. Are there any members of the board that wishes to ask any questions? New. Okay, what I will say is we will now end the recording and end the official part of the meeting. I would like people to remain seated so that I can have a quick discussion with you for 10 minutes once the media and everyone's left.